Okay, good afternoon, everybody. Is Esme on or?
She's here.
Oh, she's here. Oh, okay.
Here,
Oh, okay, I didn't know. She was not feeling well, so I didn't know.
she just came in, she was running.
Okay. Oh, good. Okay, so we are, gonna have some discussion about, which now you will see on our agenda is DR 26 and then some other number. That's the new, number for people sitting around the outside for our homelessness bill.
What is it, Kim?
It's on your agenda.
It's on the agenda. If you refresh, it's on the agenda.
Oh, I just shut it so I could look it up. That's
Okay.
okay, I'll look it up. Well, I'll look it up.
Yeah,
That's
you're
okay.
gonna see it a lot on there, so
Okay,
no worries.
that's okay.
I don't have it memorized yet.
Okay, I'll find it.
And just as a reminder for people, all that means is that's a committee bill. So DR stands for drafting request in 2026, and then it has a number, okay? So, been a lot of discussions happening, a lot of discussions, a lot of thinking, a lot of, trying to find a path forward. A lot of listening to the testimony from yesterday that came from the advocates and providers, and a lot of sleeplessness. And Eric's been doing a lot of thinking about this, as I mean, we all have, but Eric has been doing a lot amount of thinking about this. You know, we've been talking about this sort of continuum of services, and, you know, kind of what would that look like? And I'm gonna let Eric describe in a minute, from his perspective, what he's been kind of trying to outline over the last 24 hours. But what we are talking about is ending the separation of this thing that has been known as the GA hotel motel house emergency housing, ending that separation from what all the rest of the services are provided under OEO.
If the computer work.
And really talking about an overhaul of how we think about it. So I think everybody knows, because we've said it, you know, in here a lot, that the emergency housing under general assistance has been set up as a benefit, like most of the things in GA. Most of the other things are set up as benefits. That's how it was originally envisioned many, many decades ago. But what we know now is that that's not a successful way to necessarily help people transition to permanent housing. And so what we've been thinking about is how do we transition that out of ESD and have it be one component of a broader continuum that's managed in OEO, so that everything is managed in OEO, and that we look at the use of, you know, levels, tiers, whatever, you know, whatever you want to call them, but everything from at the least restrictive end of the continuum, which would be, you know, something like our emergency cold weather shelters, where if there's capacity, you're, you know, and as long as you are sort of following the rules that individual location is set up, then you are able to be there, and out of the cold, up through including use of hotels at, under certain circumstances, use of more formal shelters, use of informal mechanisms like neighbors helping neighbors, like, you know, small bit of help that could help somebody stay housed. So including prevention in that, up through more formal shelters that we've seen, that we have 649 beds of right now, and we're looking at some expansion. I don't know exactly how many beds because they haven't really said how many. Up through to permanent supportive housing for those people who need supportive housing, and just permanent housing for those people who don't need the extra supports. So looking about that as being all under one umbrella. And
Thank you.
um,
Computer won't work.
oh, do you need power?
No, it won't let me in committee.
Oh.
He's doing it for me.
Okay. I was just about to turn it over to Eric, but I will when he comes back in. But it would require, I don't want people to sort of like, get too up in arms sitting around the outside. You know, us to formally say that we're ending the GA emergency housing benefit. So, and in order for those resources to be working more towards the supportive housing as well as emergency housing under this new umbrella of services at OEO. So now I'm going to turn it over to Eric to describe a little bit about what he's been working on, and in particular around this sort of notion of eligibility and all of that kind of stuff, because we heard some interesting discussion yesterday about how coordinated entry might serve as a method for looking at that.
I'm sorry, before you go to Eric, if I can just clarify. So you said we're going to use the language that we're ending the hotel motel benefit.
But this is just discussion at this point in time.
Yeah, right. Like that's what kind of going to be up for discussion and consideration. I just want to clarify that that does not mean that we're going to stop using hotel motels
Correct,
as shelter.
correct.
Okay, thank you.
I have a follow-up question on that. And in moving it to OEO and within the budget, we prescribe an amount that should be used for emergency housing purposes, just given the moving around of funds and what we experienced with HOP, where money that was intended was used elsewhere. I am just going to say, like, without prescriptive levels, this is a non-starter for me.
Yeah, no, hopefully people have a sense of the issues we've had with implementation of what I would call legislative intent. That I am not in favor of leaving that up to the discretion of the Department or Agency of Human Services. So Eric,
Thank you.
I'm turning over to you, and I'm just going to caution you before you get going. That right hand of yours very often comes very close to hitting Representative Steady in the face.
Yes.
The other day, you were
It's,
going like this, and I was
yeah.
watching Brenda's eyes go up and down.
Yeah, I actually watched, I reviewed the tape and I was like, wow.
I know, I was like,
So, just quickly, I'll give a brief overview. And,
and we don't have any legislative language. This,
Yeah.
again, Eric has been thinking about this overnight. We both have, and trying really to take into consideration the testimony that we've heard from all the parties, both this year and last year, about needing to have something that Vermonters understand. And I'm still going to go back to the statement that we had from a witness early on, which I think was Chad, around people are complex, but systems should not be. The systems should be more simple. So now I'll be quiet and I'll let you talk.
yeah, just, share a little bit of rationale and then maybe just share a little bit more in regards to, kind of where the perspective was. And I believe that we all want to achieve. We all want to make sure that we're providing the most equitable opportunity to those that are experiencing homelessness, our neighbors, our loved ones. We want to make sure we are providing the highest level of support and getting them into a system of care that's going to produce better results than we're already experiencing. So right now, we currently rely on the GA emergency housing benefit, particularly through hotel and motel placements. We know that. This is an outlier nationally. It's not producing the outcomes we need. Very few states, in fact, there are only 8 states that still have their general assistance emergency housing benefit available. Only 8 states. And with very few states operating a GA-style emergency housing program, those do, like Vermont and Maine, we rank among the highest in the nation for homelessness per capita. And in fact, the numbers do show that I did see that the 8 states that are still operating a GA benefit, 7 out of the 8 are in the top 8 in homelessness. Is that a factor? No, that's not the direct factor, but again, I think it's something that should be acknowledged. By contrast, states that have moved away from GA housing and invested in coordinated entry, rapid rehousing, permanent supportive housing have significant lower homelessness rates. This tells us something important. Maintaining GA housing does not reduce homelessness. It often creates a cycle of temporary placements without a clear path to stability. Vermont spends tens of millions annually on hotel rooms, yet we continue to see rising homelessness. The structure of GA also adds complexity. As Chad was speaking about, systems should not be complex. The structure GA, complexity, eligibility tiers, verification, fraud prevention, all tiered to a benefit that was never designed to be a long-term housing solution. The rationale for eliminating GA is pretty straightforward. First, it provides clarity. We eliminate the statutory obligations for emergency housing under GA and replace it with a system focused on outcomes, not transactions. Second, it allows for a planned transition. During the phase-out, hotels can be used under these expectations and actually are rolled into the piece of continuum of care. We do recognize that those that happen to be utilized. The benefit to that is that the individuals that are in the hotels now have direct access to coordinated entry, have access to the services of the navigators, have access to the assessments, have access to other opportunities that are going to move them out of and progress them out of the situation. Whereas we all recognize that we just warehoused, and being on that benefit, there is no obligation or responsibility on whether it's the state, the provider, the participant. This provides an opportunity to get them into the resources that are effective and work. The approach aligns Vermont with national best practices and creates those accountability mechanisms that we're talking about. It ensures that emergency shelter is a gateway to housing, not a dead end. It also positions us to leverage federal funding streams like HUD, Continuum of Care, and Medicaid for supportive services, reducing state costs over time. More importantly, it moves us toward a system that actually reduces homelessness rather than perpetuating it. If it's our legislative intent to stop investing in the hotels and build a sustainable housing response, the cleanest and most effective way to do so is through this method. This bill starts by acknowledging the reality. Vermont's homelessness crisis is working. We all know that. We currently number 1 per capita, number 4. So some of these major components: 1, eliminating it; 2, establishing that continuum of care; 3, getting the appropriate funds mechanisms into place that support the continuum of care approach. And a just quick nutshell and overview. G program, which mainly, this bill just emphasizes more or less ending GA and investing into the proven strategies that we know are effective and work. That's pretty much the direction of this.
You want to talk a little bit about coordinated entry and using that as a method
Yes.
for prioritization?
Yep.
and eligibility, really.
There are many of us in this room that do operate within the HMIS coordinated entry system, and within that, they define prioritization, they define how, we work with the most vulnerable, how the standards are expected, and that's pretty much what we are gonna operate on. Am I as astute in regards to the coordinated continuum of care? It means just that, how it's laid out. Let me keep jumping around to.
I think while Eric's doing that, one of the things that a thought process is, I guess wondering how much we rely on something that that people put a lot of effort into, and I guess utilizing it for, and I'm talking about coordinated entry, utilizing it for more than just data collection, frankly, and thinking about how, and I want to put a caveat in there, just so you know, we would need to give ourselves an out because we have no idea where the federal direction is heading. And so we would be clear about giving ourselves an out to do some state assessment or whatever. But right now, and then the witnesses yesterday talked about, just when we were having conversation about utilizing coordinated entry for, one, it's something that we already have, and then why would we develop separate prioritization? And that sort of got us to thinking about, well, why would we, if we have a system that could be used, that everybody is familiar with, and that we actually want more people to be familiar with? So one of the things would be to require the Agency of Human Services to require this in all of their grant agreements with the community partners that exist out there, so that the AAAs would have to participate, the designated and specialized service agencies would have to participate, parent-child centers would have to participate. So, we realize that means, there's license restrictions and all of that kind of stuff. And, those kind of details would have to be worked out. But trying to actually broaden the people who are responsible so people would have an in with people that they feel most comfortable with.
Which was one of the recommendations of the GA Emergency Housing Task Force a couple of years ago.
Yes.
So-
Yeah.
Yeah.
And so that's, when Eric's talking about accountability, he's really talking about accountability of the system to the people it's supposed to serve. And, not necessarily the other way around. And I think that's an important shift in what has been happening at the ground level. And, we don't need to look very far. We can look in today's news to see how people who are homeless are treated in this state, and the trauma that they experience day in and day out, with things like, needing medical care and not being able to get it, and having, so, I mean, we need to change that, and we need to be the people who are responsible for setting an example to change how people who are homeless are treated in this state. And so, and I think that by creating an expectation that I would love if someday we didn't need to have a program for people who are homeless, but that's not the foreseeable future that we're looking at.
Mhm.
And so creating a continuum of supports that people access depending upon where they are at in their lives. And it includes prevention and interventions and, some of the low cost kinds of things, all the way up to the higher cost things, that I think I just want to be clear that it's about, the accountability is about our systems being accountable to the people that they're supposed to be serving.
As in regards to the establishment of the statewide continuum of care and that investment, the program elements are such as what we're already operating with, housing navigation and case management, rapid rehousing, permanent supportive housing, non-congregate shelter, the data systems, moving the things into levels, the continual care levels, starting with 0, which is prevention and diversion right there at the front door, moving on through and investing into the emergency shelters and temporary housings. Their scopes are everything that we're already operating now, congregate, non-congregate locations, DV remains within the frame of the continuum, but how we respond to them within the HMIS system is a different element, but remain in there. Extreme weather responses. Motel uses are still in play as in regards to the same level of services in regards to case management, in regards to housing navigation is available to the individuals that are in the hotel just as much as they are to the individuals that are going through coordinated entry. The rapid rehousing, permanent supportive housing, and it also opens the door for specialized paths, removing things and eliminating the benefit. And those specialized paths are everything from youth and young adults. The wonderful organizations of Evaluate Youth Services now are able to maybe maximize other levels of funding that weren't available by taking this approach. Families, veterans, DV survivors, reentry, it's bringing the entire system together, whether it's DOC, whether it's Dale. The continuum brings the entire system together as one unified, working underneath a proven practice of success. The eligibility, prioritization, all aligned with HUD. Residency, it's irrelevant. Irrelevant, because we have diversion things and stuff like that. If people are entering on up here, they're accessing coordinated entry. So there's I don't know where I'm going with this. I'm tired.
Doing this all day.
Yeah, well, I'm not going. I believe this is the path forward. I believe this, knocks down a few barriers that we've been grappling with. The argument between GA emergency housing benefit and a continuum of care coordinated entry, we can have that one. And we need to make the investment in the one that's going to be proven to provide the outcomes that we're looking for.
Yeah, this is just discussion. Go ahead.
Can you, it's all very passionate. I don't actually really have a clue what you're suggesting. Like what are the things we got from her? But I know we don't have language, but just kind of bullet points. I think more words just gets my mind spinning. So I'm just wondering, what are the actual, the highlights? What are the solutions, the things, how have we figured out the eligibility? So are we scrapping that? And is that was one of the hard lines, my understanding from the administration. So is that no longer?
We haven't had there's been no
Okay.
discussion with the administration about this.
Okay, so I guess I'm just not.
You all are hearing it first.
I'm hearing a lot of why. I'm wondering what are the things that you that have been developed in the past 24 hours?
All right, here's the outline in a nutshell, the objective. Eliminate general housing with a tiered continuum of care alignment system that emphasizes prevention, diversion, rehousing, and targeted stabilization using braided funding with a state or federal and standardized eligibility. The approach, eliminate GA, implement the 3 levels of services statewide, adopt the uniform residency and eligibility standards, require the HMIS participation, establish performance-based contracting. So we're going to use the coordinated entry system. The key outcomes, shorter unsheltered spells, faster access to permanent housing, reduced motels usage, improved equity and accountability. The guiding principles, a continuum of care, just as outlined, standardized eligibility and prioritization consistent with HUD definitions, diversion burst to minimize shelter entries when safe and appropriate, equity and civil rights compliance by the Fair Housing Act, ADA, and Title Title 6. Data-driven performances via the HMIS with transparent public reporting. Braided funding to maximize federal leverage and minimize motel costs. Local coordination through our continuum of sales and coordinated entry.
So a few less words.
Yeah, I just like digging in. I don't have all of them, like require HMIS performance-based contracting. What does that mean to you?
Yeah.
Yeah.
I don't know what it
guess-
means yet either, but I think, I think the sort of the broad concept that I'd like the committee to be thinking about and to have some discussion about, because I don't want Katie to, we don't have any language because I haven't
Yeah,
asked
yeah.
Katie to go ahead with it, because I said, she's had fits and starts about a bunch of different things. And so I said like, well, I need to know if the committee's behind a
Yeah.
concept like this, because unless the committee's behind it, then I don't see a reason to ask her to put a lot of words to paper. That would need to come, I understand that. So, so I'm gonna, I go to the left because I'm left-handed, but if you're right-handed, you can start at the right. Okay, so at the left-handed, that we'd be talking in terms of the services. We'll talk about services first and then eligibility second. Okay, services first would focus on prevention and intervention, diversion from homelessness. You know, all of the sort of full fund kinds of things that we see community partners using now.
Just pointing out in the HUD world, diversion is also the things of services diverting somebody out of homelessness, like the rapid, like I run a diversion project and it's flexible funds. And this is a HUD one that is, you know, diverting folks from entering homelessness. But also if you have a household who, you know, they've got money, they found an apartment, they just need those moving costs, or they need help with utility deposits. So just in the broad sense, diversion isn't just from entering, it's also for those folks who can quickly exit. Okay. Yeah.
So I kind of think about rapid rehousing about that, but it doesn't matter. But we're talking all about the same thing. So we're
Okay.
talking about flexible resources
Yes.
to be used to quickly address an issue, whether it's preventing somebody from becoming homeless or quickly returning
And
them.
then short term.
And short term, right? Not long term. So it could be short term rental assistance, it could be deposits, it could be, you know, help building a ramp, it could, you know, it could be any variety of different things. So that I look at as a sort of like the least intrusive, hopefully most successful and least costly way to address. And then as you sort of move up the continuum, there would be access to, particularly in cold weather, there would still be access to emergency cold weather shelters that we have stood up where there's no barriers other than the number of places, and fire safety, I guess, imposes barriers. But so that as long as you're meeting the sort of rules of the place, you know, where you're kind of minding your own business and you're not causing a ruckus or anything, you're able to get in out of, you know, cold weather, which I would want to set in statute somehow. I wouldn't want to, -10 is too cold. Let's just put it that way. And then from there, there'd be the hopefully short-term and more intermittent use of hotels as necessary, but they would still be part of the option. And then moving again then to the more formalized shelter services that we have currently and that are under development, including some specialized shelter, thinking of a couple of the proposals that the department has put forward. And then the assisted transition. So if people need supports to move to whether it's service supported housing or family housing that doesn't need support, other than perhaps rental assistance, particularly now with the lack of federal rental assistance that's available. I would, I personally see that as a necessary thing. Otherwise, we're not going to be moving anybody. And then, you know, to independent or supported housing. So, and of course, one of the things that I think has been really telling about the data system that we currently have is the number of people who return to homelessness. So the follow along after you're in housing is really important. So the follow along that we've seen from, some of the folks like, I can't remember the name of the organization, but when Tom was here from Londonderry, and we've heard from End Homelessness Vermont, and we've heard from other, community action and some of the other providers that you need that follow along services. So it does require an investment in case management, at every level along the way. And it does involve requiring the agency of human services to engage all departments in doing sort of like what I was talking before. So that's kind of the continuum as sort of in my head, and I think Eric's.
That's an accurate interpretation.
Similar.
Yes.
And then I think that we should be doing things like breaking out resources for different segments, in terms of, so we know what we have budgeted, and doesn't mean that we can't enable some flexibility about that, but I think that we should have expectations to know what is going to be spent in each one of these buckets. Then we get to eligibility. So I know that Anna's talked about this as a concept, and we've talked about this last year somewhat, but looking at, again, we don't want this durational residency thing to come up, but essentially saying, okay, you have a certain period of time, you come and you lack shelter. And I think even the department has talked about like an intake shelter or something, intake. And I think they talked about that a little bit, didn't you, at the committee that you co-chaired? Did you talk about sort of like something that provides you shelter right away when you come, and then you figure out in those days, yeah, it's kind of like a triage space. You figure out in those few days, okay, where are you next going? And if you're agreeable to participating in, and it has to be based on people's choice, I get that. But if people don't choose to engage, then we have to think about what are the obligations. We have obligations as humans, but then we have obligations to taxpayers at the same time. And so, but what I would focus on is that there's that initial space where people are safe and, out of the weather, and able to have sort of a triage and sort of that initial quick assessment, and where you first start to develop that relationship with people who don't have relationships with any other part of the system. But there would be a requirement for a lead case manager. And that's not necessarily somebody in the housing system. It could be a designated agency. It could be a AAA. It could be a parent-child center staffer. But there would have to be a requirement for that. And I do want us to investigate the use of coordinated entry and the plan, the housing plan aspect of that. Right now, it's a lot of data, and it, results in some prioritization for access to housing.
I would love to, the youth
Curious.
part of like HMIS or RIMS as we call it.
Yeah.
We do a lot more outcomes tracking.
Yeah.
Like, how's your mental health when you start? How's your mental health? There is like status updates
Yeah.
and services they've received. So there's a lot of that is actually happening currently in HMIS. It's just the Family Youth Services Bureau kind of requires it, and they haven't, and HUD doesn't.
And
So
it doesn't,
it's already
possible
possible and being
yeah.
done in HMIS.
In some places, yeah.
Yeah.
I mean, for that
Yeah,
group
we
of
have to-
people, yeah. So, I mean, those are the kinds of things that we would.
I just can't show you, but it would be nice to have ICA in because they can do like test profiles, and you can go in and kind of actually see what clarity looks like, and which might be helpful.
So we want things to obviously be more outcome based.
Yeah.
And we hope that the investments that we make are resulting in improved well-being for people. I mean, that's what the ultimate goal is. So I haven't addressed the sort of issue of timeframes, like
Next question.
right. And it's still Eric has some thoughts about that. I don't quite agree with his thoughts about that. You know, so well, let's step back and let's just look at, you know, do we think that this is an approach that's worthy of starting to put down to paper? So, let's go with Esme.
No, absolutely.
Yeah, and then, yeah.
Clarification.
Yeah.
Here, first of all, be very curious how the conversation evolves with how we decide what case manager, who is designated to each individual, because of course, that's gonna be a huge aspect of the trust building process, which actually is what leads to effective case management. Like, we've gotten a ton of testimony about that, about the work, people who have been deemed to not be trying or, you know, not engaging. It turned out there was actually just more to the story.
Mhm.
So that'll be a really interesting discussion. And in terms of HMIS, I'm curious, are we anticipating that we would be asking, like, for example, the parent-child centers or the AAAs to be starting to use HMIS?
Mhm.
Okay. I think that makes a whole lot of sense because everyone has their own isolated data. And this totally for that.
And what we're saying is, because this issue of homelessness is so entrenched and crosses over, you know, I mean, we saw the presentations from all of AHS. It crosses over every department. And so we have a system that is in use. We don't need to create a new system. We might need to expand how that one is used a little bit, but we want other people to be using it. And as Jubilee just said, that was one of the recommendations that came back from the group that spent the whole summer talking about these issues. So, yeah.
Well, it's something, the continuum of care, it's literally saying, keep up the great work, keep doing what you're doing. Nobody's telling you how to go about doing it. We want to strengthen into this system that we know that works, different pathways to go to. Nothing's telling anybody to change that. The only thing that we're saying is, let's remove the funding of a general assistance benefit and transfer that funding into a continuum of care that we know is a proven strategy to come out of homeless. That's pretty much that's what I'm proposing. We can't operate two. We gotta choose, and the most effective choice to make, as outlined with 42 other states moving away from that, is let's invest into the strategies that we know will work.
You had your hand up. You do this
Sure.
discussion, people.
I have
Let's
a question.
let's have five people talk at once. Just
Yeah.
chime in.
Well, so I like this approach. I think it makes a lot of, it's good to hear. Good to hear sort of out of the box thinking. The kinds of questions that come to me, and I don't know if you want to even have them on the table yet, but I mean, the transition from where we are now to this is going to take some time. And what does that look like? And who's involved in transitioning? And then once the system is set up, is it fully the responsibility of just OEO with our oversight, or is there an oversight board that would sort of measure and sort of improve? Because constant, I mean, even when we get to a certain point, it strikes me that we'll need to continue improving, or we would benefit from improving, and that the more eyes we have on it, would make sense to me. I have one other question, but I can't remember right now.
May I answer that, Madam Chair?
It's discussion. Anybody can.
Yeah, actually, the continuum of care is already in place, and the mechanisms that we use already are in place. Is it robust? No, but that's where the investments get made to help build and strengthen the system that's already in place. Whether it's the data mechanisms through the HMIS, I'm in agreement with Chair Wood in regards to that system at this time is mainly a crisis response system and doesn't have the mechanisms of prevention and retention that are available. I think another second piece that is kind of cloudy in the thing is that we have two continuums of care, that being the Chittenden County continuum of care and then the statewide. I believe it'd be much more effective if we just had the statewide continuum of care. That way we're all unified under one. So I see this as strengthening what we already have in place. We have the infrastructure to expand it and work with it. But the main point is, I believe we've got to make that decision to eliminate general assistance housing benefit that has no limited to no access to the continuum of care. And as that elimination is made, it doesn't mean we're eliminating the use of hotels. Those need to get regionally equitable across the state. And with that, we also, what I mean by eliminating hotels, we do not have the capacity to eliminate every hotel room within the state. Now, with that, though, we have to also provide those same provisions. If they're working there, they should be held to the same standards that other organizations are held to. Like I said, this brings a continuum of care into place.
So I do, so the question then that comes to my mind is, what we're talking about now is, and I appreciate it very much, is focused on the person in need, the person with needs. The ability to build this continuum and have it work successfully across the state won't be able to be just focused on those people only. It's going to be involving all the different organizations that are actually playing a part in this. And how are all those people going to get, all those agencies and everything going to get more and more on the same page? I think that's actually something that probably takes training and all that kind of stuff. And are we making provisions for that? Then I think about the towns. For instance, I live near Brattleboro, which is very heavily taxed by the current program. And so as are other towns, cities, municipalities. So are we thinking about ways we're going to be supporting them through this? Are there considerations for that?
I hope that comes down the line, because I will speak very in-depthly in regards to Rutland City.
Yeah.
250 hotel rooms, people on GA benefit, the warehouse that I've forgotten about, that have limited services and horrible conditions. Period.
Yeah.
And I will ask anybody to dispute my claim right now in regards to that. I walk on in there and I still see what I see. No, if we're going to utilize those locations, they're going to maintain the same standards. That way we can get the services on in there and then draw down on using hotels as the de facto for homelessness.
Right.
That's the other thing that this stops. So yes, is hotel utilization going to go down exponentially? Yes, it has to. It has to.
This gets back to the transition, before I can even consider this, I need to know that information. Like, where are we going to put those 250 people, which we already know is not all of the people. People are still living on the streets. Are we going to spend millions to build 3,000 units, shelter units?
No.
Exactly. So people need to be able to exist somewhere. So if they don't have a shelter to exist in, they can't sleep outside, they'll get moved along. Where are we, if we're not going to provide the places, which obviously, we don't have the money, and I know there are going to be people left out no matter what we decide to do. Where are we going to allow people to exist when we have said, this is our line and we don't have any more funding, any more services? Where can those people go? What can they do? How can they meet their basic needs? Because this is, and this is what's been happening. We've been closing down the GA unit. Shockingly, our number, homelessness keeps rising. It's going to. Where can these people live? Where can they sleep? Where can they maintain their activities of daily living? I struggle to wrap my head around backing any bill if we're not going to address that fundamental problem first. Because people are dying. Another
That's
person
my
died,
segue. That's my segue for my one-time speech. I'm not going to repeat it, but it may take a little bit. I really hope that the more I listen, the more I could, be more receptive to broader ideas. And to the contrary, the more I listen, the more, locked in I get to a narrow view. I think, the full continuum of care we're talking about is the right ultimate thing. It's what we would want to do. From where does a person get in out of the cold to permanent supported housing? But we have to deal in realities, unless there might be people that say, well, of course, that's what we have to do, but we know it's not reality. Unless we, like raised a big tax that was for, resolving, addressing all aspects. And knowing that that's not likely to happen, then it becomes, how much can you do with the money you have and what do you prioritize? Because we've got capacity issues at all levels and addressing them means money or prioritizing. And I was great, say the obligation to humans. And what is the primary obligation to humans that we have as a society? Regardless of what we would like to do more or expand that obligation. And I believe that it is creating a place of last resort for everyone and anyone who needs it. And I'm sorry, that might be congregate shelters. I know nobody wants those, but you know what? If that's the baseline for everyone having access, and then we do everything we can to build beyond that. But the first priority being that basic roof over the head available. Not everybody's even going to want it, but available. And at any time, not when it's 20 below or 10 below, or even under the old adverse conditions. And I think that has to be the first level of investment. And I started thinking about like other systems we have. We've got the system of addressing child abuse and neglect. And there are a lot of ways we'd like to enhance it and do better. And I could see, we want to enhance our foster care system. Kids get bounced around. We need more support for foster parents. We need to make it better for kids. But given the world of every piece of funding has limits, if we then had to say, well, we've got to work on priorities of where we invest. So let's look at the child abuse hotline and triage who's most vulnerable. Hello, I'm calling about my neighbor's kid being beaten. I see the broken bones. Well, how old is this child you're seeing? Well, 5. Oh, sorry. Doesn't meet our priority category. That's got to be under 1 because that's clearly the most vulnerable. Or healthcare, our cardiac care response, we want healthcare for all. We want to be able to attract good cardiologists. We want to have surgical capacity. And we got a priorities. How do we do that? Well, we probably need to triage who can come to the emergency room. That's kind of what we're saying. And I don't think that's the way to do it. I don't, we could do with our transportation system, right? If a bridge collapses, well, we got to plan how to rebuild it. We got to get transportation around the gap in the, and don't have the money to rescue the people whose cars fell off when the bridge collapsed. But we gotta fix that bridge. So, and nothing in what we've talked about, and even the governor's plan, expanding shelters. Well, my definition of a shelter, really, the emergency shelter means that basic roof. And that's not what we talk about in this committee most of the time when we talk about expanding shelter capacity. We're talking about what I would call emergency housing. It's longer. It's not just a bare roof over your head so you don't freeze to death in the cold, which we have people doing, which is unconscionable. So I can support the continuum of care we're talking about as long as it started with access to shelter with everyone. But then I can't support at all some of the priorities we're discussing because I think that first one has to be fully addressed first. So that's it. I'll shut up. That's.
I'm actually in, I'm thinking along the same lines as Anne, but what I kind of bump into is I agree that, that we need to have a place for everybody. And it needs to be bare bones because we have limited resources. I think that I'm in agreement with. What I bump up against is that there is no place for those people to go. So
I know.
That's gonna become a long term.
Well, it's the same when we
And
talk
that-
about a triage thing. We
Right.
can talk about a short-term triage, but if there's no one to treat, but so you have to add and build and you got to do as much as you can, increasing that. But
So, but I mean, there's no easy solution, but like you're envisioning, a segment of the population being in these congregate shelters that are not ideal for their well-being or for their success, right? Like
some
it's not
people
saying
get
that-
stuck there till we build a better system.
Right,
But it's better for them to be stuck there than stuck outside.
that's a valid point.
Maybe to add on to the very emergency, just roof over our head situation, like, an example in the past when, like the administration had stood up emergency, I don't know if they can be called emergency, but those big shelters with outside contractors from like North Carolina to staff it and all that. We talking about, use. Obviously, the percentage of people in need of shelter was not matching up with the amount of beds that they stood up, so there's that middle ground piece of how do we, when we do invest money in these emergency type, like just that first level, needing a roof over your head in whatever weather condition. Like you have the contrast there with, for example, Beth, I'm so sorry, her last name, Beth of
Beth Ann Mayer.
Beth and Mayor of the Church of Montpelier, and like meeting the volunteers who work at like 4M, some friends of mine volunteer there, and it's like they're maxed out, right? So what is the difference there in the uptake of that kind of very specific emergency shelter? And it's like, I do think it's a level of community and trust. And so like when we are considering,
Transportation, it's
course,
access.
access.
It's rural areas that have nothing. I mean,
All
rural, somebody who's homeless in Northfield can't get to Montpelier or Barry.
totally. And so, and of course, your point needs to be, it's life. We need to sustain life, number one, obviously, but the barriers could be too large for whatever reason in people's decision-making factors, or not even a decision, but just the reality, like why they aren't going to that kind of shelter, why they are going to a different kind of shelter. So where we are making investments, being very strategic there about who's providing that and giving them appropriate money to do so.
I think one of the things, this comes back to what Zahn was asking about before, but that I would see included in this, which might help a little bit with what you're talking about, Ann, because I agree with you about that, is grants to municipalities. Because that's actually where it's going to happen at the municipal level. It's not, right, and that's a place where you can get to some of the more rural parts of the state that you're not going to, you're not gonna stand up a permanent, shelter for somebody to access whenever they need it kind of thing, but I would see, part of whatever response we come up with, that municipalities are included in that because they, around the state, we've heard from, several of them here, but there's many more that we haven't heard from that are doing the same thing. And they're doing it on their own for the most part. And I think that they're going to be the place that we're going to have to rely on for that basic level of, providing something for people to get in out of the weather if they're so choosing to do that. So I see a bigger investment in municipalities than what currently exists out there now, which is not very much, to be honest.
And that comes back to, that means tough choices on the other, because if you have a bigger investment in one, there's only one balloon to squeeze.
Yeah, but I think you make a valid point about, it's life sustaining, support, and we can't force people to come in, but we have to
Give them the option.
give them
Give
the
them the
opportunity,
choice.
give them the choice to do so, and give the people the resources, as best we can to assist them in providing that opportunity for people. And we, I hear you about transportation, but honestly, we're not gonna be able to solve that. No, I don't think in this bill.
No, but if you have the, if you have it in municipal, it's.
I think that would help with
More-
that.
more
because it's a lot
municipalities.
closer to.
Yeah,
what
bringing
people
it
want.
Volunteers can pick up, when
Bringing
you're
it
doing
closer to where people are.
Yes,
Yeah,
yes.
yeah, I know.
We said, well, it didn't get used.
Miles
but-
out of town with no
Well, that's right, the
sidewalk.
National Guard warehouse,
I know.
that you couldn't, that was a couple miles down the road to walk
Yeah.
even from downtown Montpelier, of
Yeah.
course that was.
Yeah, not logical. Yeah.
So this is really basic for just me. I think, maybe other people have the same question. I hear the number that we have about 4,500 to, let's say, to 5,000 homeless people in the state. I have no idea how many beds we have currently that could begin to take care of any of those people. I hear all these numbers, but I don't know if we know, are we,
649 shelter beds, right?
well, yeah, okay, but there are.
There's
there-
roughly, in terms of hotel usage, it fluctuates during the winter, between, 1,200 and 1,400 to 1,500.
All right, so
And
we have the,
649 hotel beds, that's
That open.
No,
Decisions?
no.
Because
wait,
Yeah.
649 shelter beds?
that's
Yes.
the max.
Yeah,
The
no,
usable, like if you have
Right.
a family shelter
Right.
and you've got
Right.
10 bedrooms, you
Yeah.
may have 6 beds technically in a room, but it may just be a parent and a child, so.
I understand. Yeah, no, I understand.
Yeah.
I know as soon as I ask that question, there are going to be 1,000 depends that are hooking on here. But
And as Ann pointed out, that doesn't count the emergency cold weather stuff. That
I was,
the
yeah,
idea
I mean,
is
do we
to-
have any notion of how many beds there are around the
I
state?
really don't know how
We
many
do
it
have a
is.
number on those extreme cut, but I can't remember it.
So, I mean, I'm just wondering, the way my brain works is how far, to speak to your question, how far from 4,500 are we at being able to supply a bed to everyone who needs it? I don't know the answer to that. That to me would start to be a priority that we could maybe get our heads wrapped around. I don't even know what it looks like, but it's a number. Right now, I have no notion of what we need to do to get to what you're hoping for.
If we're being generous, we're at half of that now.
Yeah.
Okay.
If we're being generous,
Okay.
we're being generous. We're at-
And there are some people, we know there are 4,500 homeless people, and we know there are some, 12, who don't want to be housed. Or is that 200? I don't know that kind of thing. I mean, so, maybe, I just don't know.
And
I
how,
would say not
how
that
would we just,
necessarily that don't want to be housed. I
Right.
think that framing, it's
there's a
more
range of.
of,
but-
yeah,
But I
yeah.
mean, it's-
There's things going on that make housing
Yes, I understand. No, and I want to be completely generous here. I'm not trying to be.
And it will,
But I think
that
we,
category of folks will probably not be in the continuum of care network. So that's
Regardless.
just so we're not counting them. And if
but
they.
there's also a distinction in how, in the definition itself of homeless when you're trying to count it. Because, does that mean unsheltered homeless versus marginally sheltered but count as homeless versus, there's a lot of definitional categories of that we haven't even looked at in a while, but.
I mean, what I like about this idea is conceptually, it's the right idea. I think this continuum of care is conceptually the right idea, but where it will immediately start breaking down is when we immediately start leaving people out because we don't have the capacity to deal with it. Can we transition toward a capacity? That's what I would be interested in learning about
So
that.
I gotta be absolutely frank, and I think you all know this. The governor is not interested in increasing the amount of money in this area.
I understand
Period.
that.
And it's not that I agree with that. But it is
It's
sort
a
of,
reality.
it's the confines
Political.
of what we're dealing with. Okay, so, and in fact, he wants to reduce the amount that's going into this area. And so I think that, I would love to be able to reduce the amount that's going into providing homelessness services because that.
Based on reducing the,
We're reducing homes.
Love to be able to
not
do
based
that.
on just a.
Not just based
Random
upon a
number.
random idea that we should return to, yeah.
Let's just reduce the number of beds. That
Because
indicates.
that's where we get to the value of, sustaining human life for those people.
Exactly.
And as Jubilee said, you know, we have example after example of, that the quote unquote system is failing people, time and again. And so, I feel like it's, you know, sort of an elephant on the table is that I don't envision us being able to serve 5,000 people.
Yeah, I don't either.
I do envision us being able to expand our capacity for local communities to respond in ways that can help people that don't feel like they have a place now. And I do envision us being able to provide more predictability to understand so we don't have to go through Human Services Board appeals every time you turn around because somebody's got a different definition of what a disability is, or isn't. I think we can improve on those things and that makes the system simpler. And I think we can have something that will hopefully be purposefully leading to more permanent housing for people. But I think we also had to be realistic that there are aspects of our current environment at the federal level that are barriers to that right now. And the biggest one that I see right now is rental assistance. And so we have a proposal before us about establishing a Vermont rental assistance program. And so how do we, I think, which not we, you've said something about putting all these things together, but those are things that we have to consider. Otherwise, we're setting up this continuum and it has no place to go.
Exactly.
But the one idea that I really happen to like, this concept that when we expand, shelter beds or emergency housing, they'd be designed in mind as convertible. That idea of convertible. I mean, I think that's really a
Yes.
key in terms of efficiency of moving towards we want.
Well, we had that plan from Champlain Housing Trust. We had talked about that a
Yes,
bit,
yes,
especially with like folks with intellectual disabilities and models. So I was happy to see that brought back. I think, and what I was saying more, and we see it now, there is already a whole lot of people who are left out of our system. And what we're also seeing on a federal level, and we're starting to see it, I believe, in the reaction and the way we are tackling issues in Vermont, is this push to criminalize homelessness, especially folks who are unsheltered and homeless and maybe camping. We heard from the Department of Transportation and moving folks out of right of way. And so in my head, really, when I was saying that is, I know we're not even going to be able to build a roof, like a congregate shelter, with the amount of money we have. That is not enough money to do even that. So figuring out a way where people can exist when there's not access to emergency shelters, a place they can camp, where they can exist without risking criminal penalties or tickets or things that lead onto a path of entry into that system, which is going to be a whole lot more expensive having all these people wind up in jail than figuring out these things now. And that is
Don't arrest self-shelter comes even before.
yeah, and we see this
constant-
time and time again, where we're not doing this work to prevent people from ending up in these really higher cost systems of care. And yes, in case you're wondering, there is a bill
Downstairs.
around camping, but it's something we have talked about in prior, not so much last year, but last biennium. And didn't quite ever get language, but,
It belongs in this bill
I,
instead of
I'm
wherever it
making,
is.
I'm making a note about that.
okay, it's just, I don't want people, I mean, I don't want us to have a camping policy or something like that.
Right.
But I also don't want to see people winding up in jail, winding up in situations with police that is incredibly traumatic and just makes it even harder to engage in our systems. I don't want to see that happen. I don't think it will help anybody, and I don't think all of the things we're dealing with in Vermont would just compound them.
Okay, so, you have something you want to add?
Yeah,
I'm
just
I'm
wanna-
gonna try to wrap.
So
this.
what I'm hearing though is, where I'm kind of a little bit confused in what I'm hearing. If we put the money towards the GA benefit,
Who's talking about the GA now?
Oh, he said if we were to move it.
Oh, move it. I thought you said if we were gonna put it. I'm sorry.
so what I'm actually hearing and from what's being explained, it sounds like it's practical to say, take the money, eliminate the GA, and that bucket of money now goes into the continuum of care.
But what I also hear, just so I want to make sure that people understood that I heard them, was that is, so people don't have, I'm going to summarize, that's where I was headed. I was going to summarize. So to summarize this last hour of discussion is that in concept, that the notion of a continuum of care, recognizing opportunities for protection of people all over the state, wherever they are. And I just want to be forthright about, I see that as grants to municipalities as a way to do it, as a logical way to do that. All the way through to supportive housing, that the notion of a continuum of care is something that people can get behind but not say yes to until we see the details of, are there limitations? How much are we going to put in each bucket? I do think that if we are going to move in that direction, I do not personally feel comfortable just saying, here's X number of millions and here's the continuum and you decide, DCF, where it's going to go.
Right.
That won't fly for me. That, we would want to give
Part of our
direction.
job.
We would want to give direction about how much of appropriations, and we have base and we have one time, would go into, the various levels of the continuum of care. And I fully understand that people can't get behind something like that until they know like how much we'd be proposing to put into things like the emergency housing capacity. Or emergency shelter down, I'm going like here because it's down here on this end of the continuum. Yeah.
I would go one step further. I am not willing until I know what the number of folks who wind up unsheltered because of this looks like. I personally, after seeing the number of people who are dying, I am not willing to create one more unsheltered household in Vermont. So I will not get on board. We talked a bit about that one-to-one. Yesterday, if we're losing a shelter, a hotel, if we're creating not losing like a hotel room, if there is not an equal shelter bed, I am not unsheltering anyone. I'm not sending a Vermonter to their death. So that's my red line.
Yeah, and I just want to be clear, we're not going to create 1,500 more shelter beds.
Exactly. So what I'm just saying, I'm not going to sign on and support a bill. I would rather the status quo, which I also know will not happen, but that's my line. I can't personally
I understand.
continue to do that.
I understand. Okay, so I'm going to try to work with Katie to put some words, paper, around some of the concepts, but also some of the buckets that we're talking about. And tomorrow we will have an opportunity to drill down with DCF around the money aspects of what's in the budget, about what's in carry forward with DCF, both from 25 and what they anticipate for 26. And really to ask some pointed questions about, what their intent was. I think we should probably be clear to be on the record about what the intent is, because I'll be honest, I don't find it clear while the booklet of information is a lot of information, it is decidedly unclear about what their intent is. It's just the housing proposal is just little snippets of, this is where we want to spend a bunch of money.
Especially like and where does it go from there?
Yeah.
Yeah.
So, the only reason that I know that their intent is to move backwards to the adverse weather conditions pre-COVID, night to night, is because we asked that question when Eric and I met with them on Monday. I mean, that's not any place in any document that I've read. So,
I think that's fiscally contradictory, actually.
So we have the opportunity to sort of weave what questions we'll ask tomorrow with further input into this. I'm not giving up on creating a more sustainable, responsive system. And I definitely hear where you're coming from, and I think that needs to be taken into consideration in terms of how that transition works. And I'm not going to be, there are going to be people leaving on April 1st or March 31st, because that's the way the system is set up right now. But there isn't any way that I'm going to have our committees mark on a system that goes back to one day you're in, the next day you're out, depending upon if it's 31 degrees or 29 degrees. That's not what we're going to agree to. Okay, so.
Or -9 versus -10.
10, yeah, exactly. I mean, there's always going to be cutoffs, but,
Yeah.
but they need to be ones that have a little bit more basis in rational human existence. If any human existence is rational, I don't know if that was the right. I don't know. Okay, so, folks, so for the next little over an hour, you have time to work on budget and thinking about the concepts that we just talked about. And I'm gonna spend a little time with Katie, just trying to sort of like think about stuff, and think about how I can help direct, so that you actually do have something to look on paper that you can respond and react to and change and modify. Okay. Okay. Thank you, Lori. And so this will end live time for Human Services for today, and we'll be back tomorrow.